We are at the Marriott here tonight to honor 5 women who have received the Nurses the Heart of Healthcare Awards. Join us. It's a lot of fun and you'll see why they were the winners.
I'm Shelby Peterson. I'm the Director of Operations at the Community Health Center.
I'm Jennifer Kuiken, and I am Director of Nursing at Happy Siesta Healthcare Center in Remsen, Iowa.
I am Chantelle, Prins, and I am a clinic nurse at Family Healthcare.
Joni Greeter, Medical Oncology Nurse Manager at the Joni Nylen Cancer Center.
My name is Jackie Barber, and I'm the Dean of Nursing at Morningside College. I teach nursing, and I also take care of patients at a company called Continued Care Home Infusion.
Happy Nurses Week. It's a great time to be here. And on behalf of our presenting sponsor, Unity Point Health St. Luke's, we want to welcome you to our 3rd annual Nurses the Heart of Healthcare. Please welcome Wendy Lynn.
I would say that every nurse in this room has been tested over this last year. The entire profession was tested. All healthcare workers have been tested. So I just want to say that I am grateful for each and every one of the nurses in this room. I am very proud to be a member of the profession and to serve with you on a daily basis. Thank you very much.
Our first recipient, Dr. Jackie Barber. Why teaching? Why that aspect?
I really wanted to contribute more to the nursing profession, and I thought this was another way that I could step up outside of just taking care of patients and families. All of my experiences have prepared me to be ready for a year like this. Mostly, I think we learn how to be very flexible. There isn't a boring moment in nursing. You have to be very flexible. Each moment is different. And being able to utilize your team to get through crisis is very important.
Our next recipient is Joan Greeter from the Joni Nylen Cancer Center.
Nursing is a passion, and it's one of those things where it truly is a calling, and those that are extremely dedicated, as I have the privilege of working with those coworkers, and I think it's one of those things where we are invested in them, and we want the best outcome for our patients and their families. And I think sometimes when we have to either deliver bad things or push them in a direction that they may not want to go, it is for their best, and we hope that maybe down the road they can understand that. Oncology care is advancing tremendously. In the number of years that I've been involved in it, we used to have such limited options for our patients, and now it's just exploding. The research that is being done, the therapies that are available. First, I need to thank my husband. He has been my rock. He has really helped me through some very difficult years.
Our next recipient is Jennifer Kuiken from Happy Siesta Healthcare Center. What's a typical day like for you?
I don't think there is a typical day. Sure, I go into every day with a plan of what I want to accomplish, but it's often trumped by impromptu events or things that come up. Being a nurse, I think that we all understand that we have to kind of fly by the seat of our pants every day, that things change at the drop of a hat. We have to be prepared for that.
We worked very hard on incorporating a lot more activities into our day for them, and we taught them technology, so we were able to incorporate FaceTiming into their lives. That was a new thing for many of them, teaching them, and also with the families. So it became a new normal to have FaceTime calls very frequently. So we kept them connected to their families.
What did you learn about yourself during the last year?
That I'm stronger than I thought I was, definitely.
It is definitely a team. We all share the same goal, the same passion for care. And I also accept on behalf of everybody that I work with.
Nursing is the type of position that requires a person who is extremely passionate about people. Our next recipient is Shelby Peterson. How do you keep it from being routine?
every day at the health center is something different. We serve so many patients and are able to get back to them, so it's never the same day there.
What's the most fun you've had as being a nurse?
Oh, boy. Probably this past year is challenging as it's been.
It was fun too.
Well, we had a testing site, and so we had to make it fun. We were out there when it was 20 degrees, we were out there when it was 100 degrees, so we did whatever we had to make it fun. I remember when we first started testing, the first day we kind of just were trying to see how it would go, and we tested 30 patients, and within 3 weeks we tested 450 in one day. Not only at our testing site, but we had patients from all over that just drove up. So we also opened up our parking lot, and for those individuals who showed up, we ran a clinic in the parking lot. So we did probably at least another 100, 120 every day in the parking lot. All the individuals here in Kuiken accept us on behalf of every nurse at the health center.
Congratulations, Shelby Peterson. Our next winner is our Reader's Choice winner, Chantelle, Prins from Family Healthcare Siouxland, Northside. What's it like working for a typical doctor?
The hardest to work for. He once put a whoopee cushion under my little chair cushion thing. And it went off. And I said, excuse me.
Did he live to see the next day?
Well, yeah, he wasn't very happy I didn't get embarrassed.
Did you get him back?
Well, yes.
How did you change this year?
I think it affected everyone, whether you're a nurse or not. Just with everything closing and being exposed, whether you had a quarantine or caring for patients or even talking to patients on the phone with things that are changing, the guidelines that are changing every day. I think it's a big honor to win the award. Obviously, I was very nervous, and I don't like all the little eyes on me, but I am honored for it, and I appreciate who nominated me.
I certainly win this award on everyone at the health center. I've been there for 28 years, and there's not a nurse that didn't step up this year, so it means everything that we do is worth it. The last year there were days when you thought, how am I going to get up and make it? And you just did.
What we do every day comes, yes, very naturally, and I certainly feel very appreciated in my job, in my role, and I certainly want to make an impact on my patients and coworkers and that kind of stuff. But it's definitely an honor that I know is not my own.
This is an extreme honor. Absolutely, I feel very, very humbling at the fact that there are so many great nurses out there. And I think, again, nursing is not about one individual, it's about your team and all of your peers and the whole healthcare team. Because the whole healthcare team equally has just as important role in caring for patients and families. But this is really, truly an honor to have this.
I am so proud of you, all that you've done, because really, when we need you, you are there. And that is too cool. That is too cool. We are giving out 5 trophies, but the room is filled with trophy winners. And so, congratulations to all of you, because I think you deserve it. Ladies and gentlemen, please welcome Nurses the Heart of Healthcare, your 2021